We just heard about various coronavirus strains in the UK causing some consternation, and some health officials in the US have said it's likely that various variants are already here and have arrived in the US as well. So, how do we find them? What do we do about them? How do we handle this crisis at this point in the pandemic? Dr. Ethan Berke is joining us now. He's UnitedHealth Group Chief Public Health Officer. Anjali Kamlani, who covers healthcare for us, is also with us. Dr. Berke, thank you for being here. As we get all of these headlines about these new variants, I know that you at UnitedHealth, of course, you're focused on the vaccines, but you're focused still on testing, which we still need to do a lot of in the meantime. Do we need to rethink testing at all, given these new variants? Or are we confident that tests will account for variants and still detect COVID-19, even with the disease shifting?
Yeah, that's a great question, and I think it's important to remember that while testing is important, even with new variants, and as we learn more about the virus over these next weeks and months, we don't want to stop the measures that actually prevent transmission, things like physical distancing, wearing our mask, washing our hands. Testing doesn't prevent us from getting the virus. It helps us know if we have it and might help us adjust our actions. But just because you have a test doesn't give us any sort of immunity. But the tests that we do have over a number of different categories, whether it's the rapid tests that are antigen tests or the tests that take a little bit longer to run, but are a bit more accurate, called PCR, all can detect these changes in the variants of the virus that we're starting to see out of the UK.
Dr. Berke, Anjali here. Looking at the mandate that has come down to cover the testing and ongoing COVID treatments from the federal government, I just wonder, looking forward, do you expect that to continue for the various types? And what about the at-home testing as well? Have there been discussions about reimbursement for that?
I'm not completely clear on how that's going to play out over the future. Certainly, as we exit the legislation around public health emergency, we might see some changes. But currently, testing is covered for patients who need it under the CARES Act, and we'll have to see how that goes over the future. The other area that's of interest is testing not just individuals but groups of people to help get institutions back. Schools, we're starting to see that with transportation as well. And the way that's reimbursed over time is also something that we're paying close attention to.
Doctor, how do you think coverage for folks will change over time in their life after COVID? Clearly, obviously, so many people have been affected by this, either mentally or physically. How will coverage have to change?
Well, we are watching, some people call it long haulers, or there's a long-term COVID sequelae where people get heart conditions, lung conditions, all sorts of different chronic medical issues that could last weeks, months, or even years. And those need to be taken care of through your medical provider and treated. Right now, those conditions would be treated as medical issues and covered over time. And because of the pre-existing condition rules that are part of the Affordable Cares Act, and COVID being a diagnosis, that would be covered like a medical condition. As healthcare legislation continues to evolve in the country, we'll have to pay close attention to that.
And Dr. Berke, I'm also curious, as we come out of the pandemic, what happens to the healthcare industry in terms of, a lot of people are still not going to see their healthcare providers, or they're not seeking treatment for chronic conditions. So do we see sort of an explosion in diagnoses and a need for treatment coming out of this?
Yeah, it's a really interesting question. And we saw early on in the pandemic a very rapid drop in access to primary care visits. We saw a decrease in cancer screening in particular. One of the metrics that we track at UnitedHealth Group is around colon cancer screening, and we saw a large drop in the number of colonoscopies, for instance, because that's a procedure that's elective and requires you to go to a medical facility. Now, there are other options to get screened for colon cancer, non-invasive testing that you can do at home. But as this healthcare system started to open again, we did see visits return back to closer to where they were, but not completely. But we do expect that we're going to have an issue with people not getting the appropriate screening tests, not getting their routine medical care, and that's going to have long-term sequelae for people. So it's important to continue to get screened, and there are alternative ways to access healthcare that don't necessarily involve going into the physician's office. And at UnitedHealth Group, we've been working a lot on thinking about telehealth platforms and even care at home using kits that we mail to patients where they can, with a telehealth visit, access some of the testing and treatment resources right in their house. So we're trying to find alternative ways that make it safe and comfortable to still get screened, still get preventive care, and not fall behind on those really critical metrics that play out over the course of your life.
Certainly going to be interesting to see how telehealth and remote monitoring play a role in the coming year. But I just want to ask you like a really quick question. One, what do you, when we saw this pandemic start to hit the country, there was a lot of criticism about how it was managed. And so I wonder if there is one thing specifically that you wish this current administration had done, and then one thing that you're looking forward to for the incoming Biden administration to do to help ease the way that you can operate.
Yeah, that's hard because it's a pandemic's not something we all deal with every day. I think we're always learning, and the situation on the ground is always evolving. I think we could have done a little better with getting our masks on and getting physically distanced. But I think we're all getting the message now, and we're starting to see the impact of that. And when regions close down and work a little bit harder on those mitigation measures, we do see a response. So people are learning there's a cause and effect. And I'm really looking forward to the new administration to continuing those efforts that the CDC and Dr. Fauci at NIH and others have been advocating for. And I'm looking forward to getting schools open and some of our larger critical infrastructure and institutions back through a program of more frequent testing, continuing with these prevention measures. And of course, we're looking forward to the impact of the vaccine, but that's going to take a little bit of time for the vaccine to have its full effect on herd immunity. It will certainly have an impact on severe symptoms for the individual, but we don't want to wait for that vaccine effect to take place and ignore the other measures that I had just mentioned.
Yes, indeed. An important message still. Dr. Ethan Berke, thank you so much. UnitedHealth Group Chief Public Health Officer and our Anjali Kamlani. Appreciate it.